On this episode of Putting Possibility into Practice, we're talking about implementing a GRS platform into your practice, what goes into that, and we will tackle an interesting topic. What is otolaryngology? We'll talk with a practice that partners with Greenway Health. We'll learn all about it, the services that they offer, how they're serving their community, and how they partner with our GRS team for revenue cycle management. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and welcome to this episode of our podcast, Putting Possibility into Practice. If you are a returning listener, I thank you for tuning in once again, and if you are a new listener, at the conclusion of today's episode, we'll let you know how you can subscribe to our podcast and the platform of choice of which we are available on. And on this episode, we are talking to associates of, and this is part of the whole episode, Otolaryngology. I hope I pronounced that right. I welcome Lois, who is the practice administrator. Diana McClernon is the manager of support services. Did I get the hardest word out of this whole episode out of the way correctly, or do we have to go back and talk about that?
I'll have to talk about that.
Yeah. So first question I have, we'll get into your background, a little bit about the practice, but do you have patients who have a hard time pronouncing, the name of the practice or what it is?
Every single day.
We have staff that can't pronounce it.
Oh, so you have staff and patients who can't pronounce it?
Yeah, we do.
And so how exactly do you pronounce it? And as we go into the background of the practice, talk a little bit about the practice, what you guys offer, where you're located, and a little bit about your providers.
It's pronounced otolaryngology. So we are the Associates of Otolaryngology, which is ear, nose, and throat.
So when I started here, I was like, I don't know how to say this word. So I just broke it down and I say otolaryngology.
Perfect.
Together, otolaryngology.
And how big is the practice? How many providers do you have? Where are you located?
We have 7 doctors and 1 physician's assistant. We have 4 audiologists, and we have 3 locations. And our main location is in Denver, Colorado. And then we have 1 in Lone Tree, Colorado, and 1 in Castle Rock, Colorado.
Awesome. And how long have you partnered with Greenway Health, and what are some of the current solutions that you're using on a daily basis?
We started with Greenway Health in August of 2015. And I think it was February of 2017, we partnered with GRS.
So we use the patient portal. We use secure messaging. We use Solution Reach, which is one of partners with Greenway.
And in regards to GRS, so now you've been on the, with the GRS program and our team for about a little over 2 years. Going into a revenue cycle management, how have you felt that partnership has come along from the beginning to where it is today, and when did it come time to say, hey, we really have to start looking at a vendor for revenue cycle management? We
had our own internal billing company, our billing department, and then we had a few people leave, and it's really hard to find good billing people.
Right.
And ENT billing is a little different than, say, family practice billing or anything like that. So I think somebody had said that Greenway had our GRS, and we just decided to kind of look at it at that point, just because it was, we did the math and everything. It was cheaper for us to actually go with GRS than to actually hire more people.
And since making that decision, how has your experience been with the GRS team? And you talk about having your own internal team and now, resourcing it out. Has it felt like the GRS team is a part of your team at the practice?
It has now. We had a little bit of issue at the beginning, but as Lois mentioned, ENT is a little bit difficult with regard to billing and coding and knowing all the rules. So in our practice, there's more of the other parts of the practice too, with our cosmetic portion as well as allergy and audiology. So there was a lot for them to learn about us and vice versa.
So we had a team, and then some of that team moved, and so there were some growing pains. I'll be perfectly honest with you. There were definitely some growing pains. we have one biller left with us who is really good about really checking through things and making sure everything's going well. And I would say it took a few months for things to kind of start, everybody to kind of feel like we were working together rather than against each other or not knowing what the other shoe is doing. But I think it's going pretty well. And I have to say our revenues have climbed significantly.
And I was gonna answer that. So going into the program, did you set goals as a practice as to what you were hoping to get out of the program? And if so, over the last 2 years, how have you been able to achieve those goals or maybe even exceed expectations?
When we started with GRS, I think we expected a 3% increase in revenue, and I would say we're probably at 5%.
And what advice would you have for other practices looking to bring on a revenue cycle management partner, especially in the field that you guys are in?
I would say at the beginning, when you sit down and are going to be moving forward with them, to really set out goals for each side. Who is going to be doing what? Who contacts who for what issue, and hold everybody accountable to that. Set up meetings, consistent meetings at first, at least every week, with your team, so that everybody knows what, we have a problem on this side, we have a problem on this side. What is it that we expect from the GRS team to do, and what does the GRS team expect us to do? And make sure that everybody's being held accountable to those things, for sure. I think that was part of our problem that we did not do. It took us a few months to get to that point, and I think once we started having consistent meetings and consistent goals that everybody was going to meet, things went much smoother. And make sure that you have somebody on site that is actually part of the billing team, so that you can't just let it go. You still have to watch things. You still have to make sure things are being done well on both sides. And when things aren't being done well that you think we have an issue with, don't hesitate to reach out and say, look, this isn't going well, or we have a problem with this. How do we fix it? And let's work together to make it work.
Probably the best practice is to make sure there's transparency between us and the GRS team, and don't be afraid to take some criticism sometimes, and as I said, be transparent about it and work together. We're all trying to achieve the same goal. So,
and I think one of the other reason we went with GRS is because they knew Greenway, they knew Prime Suite, and they knew how to actually do things well in Prime Suite, and we didn't think that we did. And so that was the other reason why we went with GRS, is they worked it all the time, and we knew that there were things we did not know.
And then moving forward with GRS, have you been able to continue to achieve the goals you've set out for the program from the beginning?
I think so. And they change as we go.
Mm-hmm.
When something new comes up, then we all get together and go, okay, we have a certified coder on staff here, so that when there's a new code or there's a problem with the code, she'll investigate it, and then she gets it back to the GRS team. And the cool thing about that is that the GRS team goes, oh, thank you for giving us that information, or thank you for giving us that documentation, so that we can share that across the board with everybody else. So that's kind of a nice way of working together as well. They learn things, we learn things, and then we share.
Awesome. So it sounds like really a true collaboration with your GRS team and a good relationship.
Mm-hmm. Definitely.
And as we move into the remainder of 2019, as quick as this year seems to be flying by, what are some of the other goals that the practice has in moving forward?
One of our doctors is double board certified in ENT and sleep medicine, and so he is ramping up and building his sleep program. So that's a big one for us in 2019, is to try and get that ramped and built and infrastructure around it, so that we are ready for 2020 to really hit the ground running. And
and I understand you have also introduced some new procedures to the area, correct, or to the practice at least?
One of them that goes along with the sleep medicine program is called Inspire. It's kind of like a pacemaker in that it's implanted, and it works on the glossal nerve, so those people with sleep apnea who don't tolerate CPAP very well can use this to keep their airway open. And so we've started that recently, and it's been ramping up as well. We've done several procedures on it, and it's an interesting concept for those people who can't tolerate the CPAP.
And those that have gone through the procedure seem to like it.
Yeah, they've done well.
Okay, I was just going to say, because we have allergy and we have audiology and we have facial cosmetic, in our audiology department, we're doing a new procedure for tinnitus, which is that ringing in your ears, that sound that's in your ears that you can't stand. It's a new procedure called Levo that they're starting to use here, and we've done it on a couple patients, and they seems to like it, and it seems to work quite well. So that's another procedure. And in our facial cosmetic, we're doing what's called Renuvion, which is a in-office neck lift, and we've had great results with that.
Well, as you continue to add new services, new procedures, we certainly look forward to providing the technology and innovation to help you guys continue to be successful in serving your community and continue to grow, and we thank you for your partnership.
And we thank you for being there for us.
And once again, that was I'm going to get it right on the closeout here. That was Lois Mott, Practice Administrator, Diana McClernon, Manager for Support Services at the Associates of, and we can all say it together, Otolaryngology, correct?
Correct.
See, it only took me about 18 minutes, but we're good. I finally got it down. So I want to thank both of you guys for taking time out of your day to join us on this podcast. I've enjoyed our discussion, and we'll certainly be in touch as you guys continue to experience success and growth, and we're glad the team here at Greenway is able to help fuel your success.
Thanks.
Thank you very much.
Thank you. Have a great day.
You guys too, and for more information, you can visit our website at www.greenwayhealth.com, and if you have not yet subscribed to our podcast, I invite you to do so, and you can do so on a number of our podcast platforms. They are available on iTunes, Google Play Podcasts, Stitcher, FM.Player, SoundCloud, Libsyn, Spotify, TuneIn Radio, and now on iHeartRadio. I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.